Dr. David Hill joining us Thursdays. You always set aside some time with members from the medical community. Good to see you. I appreciate you coming this morning. Speaking about autism, we'll start right away with, I didn't do a lot of research, but it's something that I know about. It's in the headlines right now with Disney. Disney now adjusting their schedules and not letting people with autism kind of get ahead in the lines. Disney taking some flack for that. When a child is dealing with autism, it is onset very early in age, because within the first 3 years?
Right. Usually by age 18 to 24 months, by a year and a half to 2 years, you can see the signs. It's hard to identify autism earlier than that, and that's ironic because the changes in the brain that lead to autistic behavior occur probably in the womb. The best information is that this is a fetal change. You can't make somebody autistic after they're born with anything that you do, but you don't see the signs until they've had a chance to develop some skills. And so about a year and a half to 2 years is the earliest that we identify it these days.
And when that child is born, I know there's what's called the spectrum of autism.
Right. Walk
us through the spectrum. What are kind of the things that parents will notice with their child?
Right. Autism is, at its core, a failure to understand how other people are thinking and feeling. So children with autism frequently will have a language delay because what you're saying, the fact that your words have meaning, doesn't tend to register. They also don't tend to be as personable. They don't tend to give hugs. One key sign, they generally won't point to show you something, and they frequently aren't interested in your interest in it. So a normal toddler really wants you to see what they're interested in. If you point at something, they want to know what's interesting to you. If a stranger walks into the room, they're going to look at your face first and say, hey, should I be scared of this person? Should I be excited about this person? How do I feel? But children with autism, because they don't really interpret your feelings and your facial expression, often won't show those cues.
What are the difficulties then for parents who are trying, you know, to raise a child with autism? How do they kind of break through to their child?
You know, there are a lot of techniques. There's some research being done right now on using the child's interests. Some children are fascinated by cartoon characters, for example, or by how the wheels on a car turn, and using those interests as a form of reward for interactive behavior, the sorts of behaviors you're trying to see. However, each child with autism is different from the next. You're really describing a whole set of behaviors that comes from a whole set of different underlying causes. So some children are very severely impaired, others are much less impaired. So it's very individualized how you deal with each child.
And you mentioned that this is something that may present itself while in the womb, but you don't notice it obviously until birth. How soon after birth should a parent kind of be leery of things and think, this is something I need to go to my physician about and really see if there's a diagnosis?
You know, usually about 18 to 24 months is when we're able to identify these things. If your child is a year and a half old and isn't using any words, I think you need to bring that to your physician's attention. If they're not walking by 18 months of age, not pointing at things. Also, the child's doctor should be doing wellness exams, and at every wellness exam, we should be evaluating development. Our practice uses the MCHAT, the Modified Checklist for Autism in Toddlers, at 18 and at 24 months, and then we use an Ages and Stages questionnaire at every wellness exam up to age 5, well, not every, but 6 months, 12 months, to see how they're developing. And we can usually identify problems early and get them help early, and we know that early help makes a difference.
And it's something I know, it's like 1 or 2 in every 1,000 children can be diagnosed with this. So it's something that the numbers are there, that there is a prevalence for this.
Yeah, and the numbers appear to be growing. The CDC, the Centers for Disease Control, released a report just last week showing that it's now up to 1 in 68 children, which is a shockingly high number, probably because we're better at identifying it as opposed to an actual growth in the number of kids, but we're looking for it, and when you look, you find.
Sure. Again, if you have any questions about what we talked about today, save yourself the time. You don't want to email me. You always want to talk to your physician, someone who, like Dr. Hill, who is very learned in a subject like this. Doctor, I appreciate it. One who's learned about weather,